Hey guys, I'm Dr. Goodnight, and today we'll be discussing vaccines that your child's receiving at their next well-child checkup.
When will my child receive vaccines? Hey, congratulations. If your child's 12 years of age or entering the 7th grade, you're almost done with well-check vaccines. At 12 years of age, they need a tetanus booster, an HPV vaccine, and a meningitis vaccine. These vaccines are repeated only twice. HPV vaccine gets a booster at 13 years of age, and then your child will need a meningitis booster at 16 years of age. And then following that, there's no other well-child vaccinations at this pediatrics office. Why are these vaccines important? Nobody likes getting pokes, so it's always good to discuss why exactly people need vaccines. Tetanus vaccine, the reason your child's getting that is because they're rambunctious. They might cut their hand on a rusty nail or get bit by some weird animal. If they have either of these things happen, that can inject a little bacteria into their body, and that bacteria can form a toxin that can actually paralyze the muscles in their body. No muscle movement means no breathing, so that's a bad thing. There's not a lot of people that ask about why they need a tetanus, but there are frequently people that ask about why a child needs their HPV vaccine or their Menveo vaccine. And honestly, I don't find a lot of doctors that can explain it very well. Here's the gist of it. Your child drinks out of somebody else's glass or kisses them or has sex with them, and they can transmit either this bacteria that can cause a brain infection, or they can transmit a virus that causes cancer over time. Biggest problem with HPV, the virus, it becomes a little wart on the wet surfaces of your body. Vagina, cervix, inside of your penis, the bottom of your throat, the gums or the lip. And you don't watch those every single day. So when it starts causing symptoms and you go to your doctor, it's usually already too late. There's about 20,000 cases of HPV-related cancer diagnosed a year, and it kills about 1,000 women of cervical cancer every year. This vaccine prevents 100% of the different viruses that cause these cancers. So it's literally a cancer cure if everybody would get it. The Menveo vaccine is preventing this little bacteria from spreading the exact same way. It goes to your throat and your ears and your nose, and it can eventually attack your meninges, which is a wrapping around your brain. That gets infected, and the child dies. The problem with that is that child gets fever and a headache, and they don't like to drink. And they sit in their bedroom because they're teenagers, and they don't ask for any help, and the illness can progress in like 3 days. So it's pretty scary in that your kid goes to bed with a fever and a headache, and 3 days later, it's a very sad, tragic story. I want to talk briefly about the HPV vaccine because it seems like of the adolescent vaccines, this one has the most hesitancy with parents. They, I think, feel like it's a new vaccine and that it may not be studied as well as the other vaccines. And that's not really true, actually. HPV vaccine has been used since 2006. There have been 90 million doses given so far. There is 5 different studies that have been done over that time, totaling about 50,000 people. And to date, it has the exact same side effect profile as tetanus. Side effects. All right. You could be forgiven for thinking these vaccines had different side effects because the last time your child got well-checked vaccines was when they were 5 years old. So it's been a while, but actually these vaccines are no different than the ones that your child got when they were about 2 months of age. They're just for different illnesses. So side effects are still fever and soreness in the first 24 hours. One other thing though, if I'm talking side effects, I'd be missing out on something if I didn't talk about the possibility of fainting. Now, a lot of people take this as like, oh, these vaccines make you faint. And that's actually not true. It seems like it because when some kids get the shots, they actually get so nervous they pass out. But if you actually think about it, how many of you parents know somebody in high school that passed out when they were like in a play or they were up in choir singing or they locked their knees? This is actually a normal thing that happens to adolescents. Their hormones are in such great swings. Anxiety can actually make their blood vessels dilate. They lose blood pressure to their brain and then they can actually faint. And any kind of traumatic or stressful event can do that. So just the fear of getting vaccines can make your child pass out. Same as a blood draw, same as standing in a big crowd. So if your child seems overly anxious, we would highly recommend you lay down for 15 minutes following the vaccine. Our providers are going to tell you to do that anyway, but we want you to know why the reason is, and the reason is we don't want you to bonk your head.
Okay guys, thank you for watching. I really appreciate it. If you guys have any questions, please ask them in the comments section of this video or give us a call, okay? Thanks, bye.